So now let's talk about the numbers a little bit. I'm sure many of you are curious about what are we seeing, what's been seen specifically within our practice. So you see on that top level of blocks, you see the numbers and percentages below it. So let's walk through this a little bit and unpack what you're seeing here. We've had over 4,000 exams. Now, I do believe that if COVID hadn't impacted us, and we're going to talk a little bit about that in a moment, that this number would be significantly higher, because this includes our early on few cameras we were using, the expansion of our practices, and then of course a pause when COVID hit and the transition to more virtual and less eye to eye, if you will, or face to face care that was being offered. But even still, in those 4,000 exams that were performed, almost 1 in 5 of our patients had pathology. In fact, the significant majority was related to diabetes pathology. However, we were picking up other pathology, whether it was a cataract or some other issue, or issues or the impact of glaucoma. This can also be picked up with this iris scan. So now what's really cool are the saves. So what is the difference between the pathology and our iris saves? Those saves are the patients who have an urgency to picking up this information. We recognize that retinopathy has a process and a progression that usually occurs. These are the patients with severe or proliferative retinopathy that has an immediate threat to the eyesight to the individual. This has allowed us to immediately call out these patients, provide direct access, because these ophthalmologists are super engaged with getting those with the greatest pathology into care as soon as possible. And the reaction of the patient, because as we know, just like we talk about blood pressure oftentimes is a silent disease, diabetes can be a silent disease until it's not. And these patients often don't recognize or realize they've had an impact to their vision, unfortunately, until it's too late. This is a way to prevent that loss of eyesight. And you see here on the number, 6.8% were defined as iris saved. That's a large percentage of patients. And here was the aha moment personally for me, and what we've shared across our practices now is many of you, like myself, may have thought that these cases would be in our most uncontrolled patients with diabetes. These are the folks who perhaps have lost a limb, they've had kidney disease, maybe they've had vision changes. Well, and while that is certainly the case for some, it's definitely not for all. In fact, what was most startling and very concerning for me was the number of patients who had pathology with a controlled A1C or an A1C less than 7 in diabetes, or they hadn't even had diabetes that long. What this scan has shared with us is that it's not necessarily correlating to the severity of the disease that you see on the outside or by the numbers, but every single patient is at risk here. So that's a message we make sure is clear to our clinicians, and especially once they have one of their very own patients with a life or sight-threatening iris save. That's when you get your convincing not only of your iris champions, but also of the physicians and the stories they tell their other patients of why this is so very important to have performed while they're there at the practice on site, because we can't take any risks with eyesight. We have 2 eyes, and I don't know about you, but I want them both. One is certainly not good enough.